So what an honor. I know many of us here have been looking forward to this moment, right? Let's raise hands. How many? Everyone. This is a co-creation, just as the integrated program in North County has been a co-creation. I'm humbled by what it is to be in the medical field. For the nurses, the doctors, and all of us in medicine, helping the patients in an environment that is not nurturing, first for the patients, for the family members, and for all of us working in the medical field. But fortunately, thanks to the persistence of the patients, family members, and all of us working in the medical field, there's been this evolution. And that's thanks to the evolution of consciousness of everyone here and thousands of people throughout the country and the world who are seeing that medicine, we need to get back to the roots, what was done centuries ago, what doctors and nurses did centuries ago. The nurses have always been there. The nurses are the ones, please stand up, nurses. All nurses stand up, we want to honor you. The medical system would not have survived without you nurses, okay? That's why we call you angel nurses. You are the ones who are always there with the patients. You are the true healers. And we want to honor and recognize you every single day. And you are the ones who brought Healing Touch to the university 2 decades ago, right? Rusty and Ellen. And it's just your persistence and your love and compassion towards the patients and towards the doctors who drive you nuts. And you've just lovingly, with a smile, help everyone. And you need to be honored and recognized. So as a medical oncologist, I've really been doing all my best to catch up with the advances in medicine and science in oncology, and then also doing this part of integrative oncology. I couldn't have done it without the team. Mary Hollander, who's the coordinator of our group, Michelle, who helped us start, Michelle Rotgard, who helped us start this 10 years ago. And then all the volunteers, some of them are here. Can I see your hands, volunteers for the San Diego Cancer Research Institute, Faye, Kim, Terry, who've helped co-create this integrated program in North County. And then we've come together with UCSD now several years ago. With Rusty and Ellen, we've been siblings for 2 decades. Ellen and I have met at the first Chopra Center program, actually over 2 decades ago. And it was wonderful since then we've been good friends with Deepak and David, and now Sheila is here, and Valencia's not here, but then with the Scripps Integrative Medicine and so many programs throughout San Diego, we are working together. And as Rusty beautifully presented, beautiful job, this is a co-creation of all of us working together. And the patients come first. So there are a lot of slides, and you have them on your handbooks, but what we're gonna do is, mostly what I would like is for this to be less of information, because you already understand and know these things. Each one of you know all these things. So I'm just going to go very briefly over the basis of oncology. Cancer these are cells that lost their purpose, they're immature. We can spend hours talking about what cancer is. But from an integrated perspective, it's just helpful to see cells that have lost their purpose, and we can aim and think of it different ways how to take care of these cells, but we have to help the patient first and help the ground where these cells are, and we can take care of the cancer cells and do different things, chemotherapy, radiation, surgery, and so many different approaches. But cancer occurs for many reasons. There are hundreds of reasons. These are just a few. There are cancer genes, there are tumor suppressor genes that are downregulated, mutations, epigenetic factors, what turns the genes on and off, and then all the different risk factors that you're well aware of. These the cells can metastasize, they can go anywhere in the body, they can remain dormant for years, sometimes decades. And we work together. I'm a medical oncologist, we work with a surgical oncologist, radiation oncologist. We come together and give a recommendation with the patients. But we can't do this without, it's a team approach in oncology. It's the nurses and all the practitioners who are working with us. And then there's this integrative oncology that has been now evolving for probably 2 decades, and you can look anywhere in integrative oncology, a lot is written about, and more centers have integrative oncology. Cancer, this is mind-boggling, 1.3 million diagnosed a year, over 500,000 die every year, 1,500. These are statistics in the States, 1 of every 4 deaths. And the lifetime probability of developing cancer is 1 in 3 in women and 1 in 2 in men. These include all cancers. So we need to embrace medicine, and there are improved medications, improved chemotherapies, and what helps, a practical thing, is it helps if we remind the patients who are getting chemotherapy to see them as healing medicines. Many people go to and receive chemo and say, well, I'm receiving poisons and toxins. We have to help them realize that these are medicines that are helping them in their healing journey. That little distinction will make a huge difference in how they'll respond to the chemotherapy and how they'll have less side effects. Monoclonal antibodies, Rituxan, Herceptin, Avastin, targeted molecular therapies. You've all heard of the miracle drug Gleevec that cured CML, when before that we didn't have a cure. The only cure was a bone marrow transplant. Anti-angiogenic agents, immunotherapy, vaccines, apoptotic. Apoptotic is natural cell death. So if we can help these cancer cells just go through the natural cell death. And there's a lot of research on apoptosis. Symptom management. At our center we have Dr. Cedarquist, I know, who's here at UCSD. She comes to North County. Dr. Mark Wallace at UCSD. Dr. Bonachter at the Scripps Integrative Medicine. And so many others. I know some of you here do symptom management, pain management, and stem cells, genomic medicines, chemosensitivity and resistant assay, molecular profiles. But epigenetics, you're going to hear it more and more and more. What turns the genes on and off? What makes a cancer gene turn on and what will make it turn off? And there are so many factors that we could get into, and that also is a separate presentation. Chemotherapy, of course, has its side effects, the GI side effects we know, organ damage, neuropathy, hair, skin, bone marrow suppression. So, but this again is evolving. We're having better medicines, better chemotherapies, and other supportive agents that will decrease these toxicities. So this is a definition that I've liked. I've used it for over a decade, but bringing together the best that medicine and science have to offer with the riches of nature, wisdom of the human body, best in natural, complementary, multidisciplinary, and multidimensional approaches, the strength of social interaction, and the power of the human spirit to heal the whole person. And the secret is the healing environment. And the part of the healing environment is the people in it. And each one of you have this capacity to create a healing environment around you. And that will make a huge difference. I'm being specific for cancer patients, but that can be applied for any other discipline. We can get into botanicals and dietary, but this is for a separate presentation. There are too many of them. We always have to remember the risks and side effects. That's what oncologists are worried about. Some of the herbals can counteract with the chemotherapy we use. There are herbs that we all know how powerful they are as antioxidants, anti-inflammatory, anti-neoplastic, but they can counteract the effect of the medicines we're using. Herbal medicine is, wonder how many of you do herbal medicine here? I mean, it's great. That's where we are working together, oncologists and you as herbalists who understand the importance of working together, and we just can't undermine what each one does. We have to honor and respect our differences, but mostly what we have in common, which is helping cancer patients. Traditional Chinese medicine, PCOM is here, representative from Pacific College of Oriental Medicine. Ayurvedic medicine, Valencia, many of you know Valencia, Sheila is here, and then our dear friends Deepak and David, who have been in San Diego now David has been here forever, but Deepak came a couple of decades ago. So this is a slide that I use when I give these talks with the Chopra Center, but this is ginger root, as simple as it is, can be miraculous for all types of GI symptoms, especially nausea, vomiting, from the cancer itself or from different medicines we use and chemotherapy. So very quickly, vitamin D3, we know how important it is. Mouth sores, mucositis, helpful to know. Lysine and glutamine can be very helpful for those who have mouth sores from radiation and chemotherapy. You have this in your slides. Alpha-lipoic acid from neuropathy. The nurses are the ones who really have been reminding patients to use this when they have neuropathy from chemotherapy. Tea tree oil for nail change is aloe vera. Triphala for both diarrhea and constipation. This is an Ayurvedic medicine. Omega-3 fatty acid. Curcumin, I have a 1-hour presentation on curcumin. There's a lot of research going on throughout the world and the use of curcumin in cancer. And the MD Anderson Cancer Center has a wonderful team looking at this and doing clinical trials with curcumin, also resveratrol. So this is just a summary. There are so many of these agents. So just going over complementary modalities, lifestyle changes, prevention, nutrition. This is, for those who do nutrition, is key. And I mentioned Mimi Guarneri here because she has a beautiful presentation when she talks about nutrition, the tree of life, and goes over many different details about nutrition. Gentle and aerobic exercise, rehab medicine. How many of you are involved with rehab medicine? If it's OT, PT, this is so important for the cancer care. Yoga, I'm mentioning some names like Daniela, who's been a volunteer and has been coming up to our program for over 6 years, every week, volunteering for the yoga program in North County. Aromatherapy, massage, acupuncture. Kim is here, of course. Kim has brought PCOM students up to North County to help the cancer patients. And Aaron, of course, you're here, and Dodie's volunteer at our North County. So I got this slide. Some of you have seen it, but I love it. Aaron, Kim have found this in a prehistoric site, and they have given this to me. Thank you very much. So acupuncture, Aaron will be talking about this, so you have it on the slides, all the things that how acupuncture can help. And I know here the Moores Cancer Center is embracing the use of acupuncture for the cancer patients here at Moores. Massage therapy, of course, is it safe? Yes, but in the right hands. So there's Terry, she's been teaching massage to massage practitioners. She's been volunteering in North County for years, over 10 years. And it's safe. I hear a lot of colleagues that say, well, massage is dangerous. Yes, in the wrong hands. Such as surgery is dangerous in the wrong hands. So it's the same thing. We just have to have a practitioner who knows what they're doing and have to have the right training. And that's what Terry and many others do to prepare those healing massage therapists who do a wonderful job and being understanding of being aware of the risk of infection, DVT, fractures, skin sensitivity, etc. Mind-body medicine techniques, you're aware of them. In North County, Diana Shimkus has been helping us with mindfulness. Steve Hickman, who will be talking to us today, has done an incredible job here at UCSD, and I'm looking forward to some of his programs. Guided imagery, self-hypnosis, Greg has been volunteering for several years in North County. Biofeedback, we have meditation with Bob in North County, and then the power of prayer. Now, we all see some studies. Whenever I see a study that says power of prayer doesn't work, I'm very suspicious of who's doing that study. We've known now for millennia that prayer helps. There's no question about it. And if we want to look at it scientifically, we have to look at the whole picture and just not look at one parameter. So those of you who know Larry Dossi, he's a wonderful, wonderful colleague who's written several books, and this is one of them. It's good to have books like this in a cancer center. Fortunately, there are hundreds of books that we can have at any cancer center for the patients and family members and for us. Support groups, All these are important: patient, caregivers, nutrition, children, support group, bereavement, social services, counselors, psychologists. There's this psychosocial oncologist, you see APOS, American Society, Psychological Oncology Society, and Wayne Bardwell, who's here at UCSD, he's been a gift to the university, and Paul Brenner has been a gift for us in North County, who's been in the community, one of the pioneers of integrative medicine in San Diego for 40 years. And spiritual oncology, Chris Lewis in our group, he's a physician assistant, but he's incorporating spiritual psychology as a physician assistant. And all of you know of Carl Simonton, who unfortunately died a couple of years ago suddenly, but he was a good friend of many of us. So energy medicine, how many here do or know energy medicine? Of all the forms, doesn't matter the name, so most of you. So you know the power of energy medicine. And there's those who say, well, energy can stimulate cancer cells. I say, yes, of course, but if you have a practitioner who knows what they're doing, we're not pushing energy, but they're being available and at service in a loving, compassionate way, they cannot harm, actually they can only help the cancer patient. So all these names, Reiki, Mary Hollander, who coordinates our program, is a Reiki master. Faye, where are you? Faye, you're known all over San Diego and all over the world, so those who don't know Faye, you will know of her very soon. Tai Chi and energy healing has several names, but Faye is going to be presenting this afternoon. So here's a true healer. Okay, I don't have to explain why these wonderful beings, enlightened beings, are healers. But this is Gracie. Gracie comes with Norma. Gracie brings Norma. And Norma walks behind Gracie. So Gracie, with these kisses and her unconditional love, of course it'll help anyone heal. So pet therapy, we all know the power of this. Here's another kiss. And these kisses don't cause infections. I mean, we have to be careful, someone who's neutropenic, we're very cautious, but when you have, of course, the chemo room is monitored by the nurses, so the nurses are the most enlightened beings, so they'll know which patient they need to keep aware from pet therapy. You know, they can use a mask, wash their hands. There are a lot of things that can be done, but here are real healers. So craniosacral, Dr. Kurisu, a good friend who has helped not only my patient, but my family, my son, and then also Blanca Noel in North County, an incredible practitioner. Applied kinesiology, those who know Warren Jacobs, he's been teaching applied kinesiology for over 2 decades, mostly in Europe, a little bit here in the States, but Europe has been open to this for a long time. Alessandra does art therapy. She does an incredible job, the healing of art. We talked about pet therapy, music, sound, humor, laughter, journaling, power of prayer, spirituality and cancer, and anything and everything that will improve quality of life. But again, it is practitioner dependent and the intention of that person who's there doing these complementary modalities and doing all the healing modalities, including those of us in the medical field. So there's this great book. You have it on your slide. You have it in the slides, right? Yeah. So here's a wonderful book, and Don Abrams, Andrew Weil have done a great job. They got a lot of oncologists to write in this book and other practitioners, and there's data for everything. So I really love this book. So we need to take care of ourselves. I'm learning this. I know Ellen Beck has been teaching this to colleagues, medical students, and the importance of taking care of us. And as you say, Ellen, see the patients as our teachers. I've heard you say this forever. The importance of us crying with the staff, taking that time to let these emotions move through, and even crying with our patients. Now, so many people say, well, doctors are cold, oncologists are cold, they don't care. Well, it's the system. It's not the doctor. It's the system we're in. How can an oncologist see 5 cancer patients an hour? It's impossible when they have to make life and death decisions. So whenever someone comes to you and says, my oncologist is mean, is cold, he doesn't care about me, please tell them that the doctors are really focusing on the little details and the big details about keeping you alive. The medicines, the labs, the radiology, the complications that happen with all the different medicines we use, the complications of cancer itself. And someone comes in with back pain, that could be potentially a spinal cord compression. A mild headache could be a brain met. So we have to understand and be compassionate on both sides, and understand what doctors, they have to see too many patients in one day. So the system has to evolve and is evolving, where physicians can spend more time with the patients. We need to deal with our own stress, helplessness, overwhelm, and burnout. How many times those of us say, I just can't do this anymore? And I'm still working as an oncologist because of the support I've had. Colleagues, nurses, friends, my dear family. And we just have to honor it. When we're burnt out, we say, I can't do this anymore. We have to spend that time. For all of us, we're all practitioners. We have to spend that time to figure out what our needs are and meet those needs. So then we can be a better service. There are challenges in the medical environment mentioned before, and just for us to embrace uncertainty. And when we understand and embrace uncertainty, and then accepting cycle of life and death. How much time do I have? 2 hours? Thank you. Okay, so 7 minutes, all right. I have this poem, so maybe I can read it at the end, but life and death. So we need to embrace this, and then we can share this with our patients. We can say, tell the patients, honor your feelings, trust your powerful inner wisdom and intuition. Rusty was mentioning about this, just helping the patients remember their inner resources, and remind them to just hang out with the people who make them feel good. If a cancer patient says, well, so-and-so makes me upset, I say, well, don't hang out with them. Go with others, hang out with those who make you feel good. And for them not to compare themselves. And there's also always a message of hope for any condition considered incurable. There could be a cure or an answer around the corner. We've all seen spontaneous remissions too. So this is not about false hope. This is about knowing that there is this uncertainty. How long any of us will live, we have no clue. But we do know that we all have a chance. And a cancer patient, even as advanced as it is, even if they're on hospice, we're all in God's hands. And we don't know how long we're going to live. I've seen more patients live longer than their doctors. Okay? So, and I'm serious. And for us physicians who talk to our colleagues, we say, listen, we know we have a medical legal reason, we have a medical legal duty to tell people how bad things can be, but we don't have to stay there. Okay? Do you know that doctors get sued for not telling people how bad things are? Okay? So of course we live in a wonderful legal environment that we can compassionately accept and understand that doctors get sued for being optimistic. So when a patient tells you, the doctor told me I have only 4 months to live, tell them they're forced to tell you that because we live in a medical system that is very compassionate. All right? So just remind them. So then they don't take it personally. I tell, don't take it, anything an oncologist tells you don't like, don't take it personally. We live in this system that 5 hours, thank you. We live in this system that we just have to accept. And that's the way it is. There are ways of saying it. Us doctors share with our colleagues. You can say how bad it could be, but then let's focus on how the great outcomes, the possibilities of doing better than the statistics, better than expected. This was on Time Magazine over a year ago. Talked about epigenetics. Wonderful presentation. You're going to hear more and more about epigenetics, but I think that is one of the sciences of the future. So how to help someone with cancer? You know this. We need to be at peace, harmony, aligned, and congruent ourselves so we can help them being present. You know these things. And we just have to remind ourselves to practice this every day. Connect in multiple levels, respecting patients' beliefs and culture differences. Most of this is nonverbal. So when a cancer patient is scared, we can just be with them, have a silent prayer, support them, ask God, our highest power, for us to just be of service for whatever person that person needs. So being an alchemist, there are a lot of different words about it, transmuting metal into gold. That's not important. What's important is how can we transmute and transform negative, disempowering feelings into empowering feelings. I put St. Francis, I need to remind myself of St. Francis' prayer every morning. Make me an instrument of your peace. Where there's hatred, let me sow love. Where there's injury, pardon. Where there's doubt, faith. Despair, hope. Darkness, light. Sadness, joy. You all do that. You all do that. That's what entrainment is. Deepak talks about limbic resonance. He gives beautiful presentations about this. Limbic resonance and entrainment is just wherever we are and how we feel, others will feel. So the patients, we're at peace, and we feel that the patients have a chance. They're going to perceive it. Summary, you have it on your slide, but mostly is for us to have inner peace and transmit that to the patients. The power of nutrition. Some people say, I can't afford organic food, which is true. The organic food can be more expensive. So this blessing for us and our patients. We need to bless our water that we drink, bless our food, the supplements, the medicines. Those blessings, and this is again, you understand it, but there's data about this. That blessing will make a huge difference. So if we can't eat organic food, or our kids take us to McDonald's, we can bless their food and ours. Exercise, good sleep, embracing all wisdoms. This is what it's about, embracing all wisdoms. Practicing healing disciplines regularly, adding these tools to our toolbox. We want to feel and help the patients be empowered, and it's all about balance. It's not extremes. There are so many people who say, I have to get on this diet that drives me nuts and has made me crazy. It's about balance. Everything is about balance. And love and connection, and just connecting to our highest power. So David Hawkins, MD, PhD, has written several books, Power versus Force, and many others. I think it's brilliant how he explains consciousness. But this is one of his sentences. Make a gift of your life and lift all mankind by being kind, considerate, forgiving, and compassionate at all times, in all places and under all conditions, with everyone as well as yourself. This is the greatest gift anyone can give. So I would like to honor all the patients, their families, caregivers, caretakers, all the professionals and practitioners of all the healing arts, and we honor you angel nurses, researchers who devote their life for research. They spend a lifetime in a lab to find answers to help people. Staff nurses, colleagues at our cancer center in North County, volunteers at the San Diego Cancer Institute, Lori, are you here? Lori Johnson. You've done a great job putting this together. Okay, we really appreciate it. Moore's Cancer Center, Trish Lolo, who's going to be leaving as the main administrator, but she's really been embracing integrative medicine. Dr. Barbara Parker and Dr. Tom Kipps, good friends of mine. I trained as an oncologist here, and I've had these conversations with them for over 2 decades. And they individually understand the importance of this. It's just hard to bring it in a big research-oriented institution, but it's happening. And the UCSD Center of Integrative Medicine, Ellen, I love you. For 2 decades we've been together. Rusty, I'm honored to work with you for the last few years. And Mike Kurisu, good friend. And Gordon, are you here? Gordon Sachs? No, he's giving a presentation later. And then medicine of the soul. We all do medicine of the soul. I just want to honor 2 people, Dr. Paul Brenner and Dr. Jesus Valverde. Jesus is from Madrid, Spain. He's just a compassionate, loving man who's come to San Diego a few times to help us and our patients. And I want to honor my family and friends. So thank you very much.